Good morning. Welcome and thank you for joining us today. I'm Frances Irwin and I serve on the board of the Marathon County Alcohol and Other Drug Partnership. Drug abuse and misuse affects everyone in Marathon County and can be especially difficult during the holiday season. Over the past year, I have been proud to serve on this board and to participate in our Pushback Against Drugs initiative. With the help of Kirk Howard and Kinsey Green, we launched this initiative 7 months ago. In that time, we've done several press conferences and panels, and we've gone door to door in neighborhoods affected by drug abuse and misuse to provide support and information to our community. We continue to work with members of the AOD Partnership to promote initiatives to expand initiatives like the medication drop boxes. Today, we're here to discuss the factors that influence youth substance abuse, supporting drug-free lifestyles, and supporting recovery in our community, especially during this holiday season. How Wisconsin is responding to the threat of drug abuse and resources that are available to address it, and what's next in 2014. Before we formally get into our program, I do want to take a minute and on behalf of Representative Wright was scheduled to be here today, but she got called to Madison for a committee hearing. So she sent us a couple statements that I will now read. I regret not being able to attend this important discussion of prevention and treatment addiction in our community, as I am in Madison working with the Assembly Committee on Education. As always, I am ready and willing to work together, both as a member of our community and in my capacity as a legislator, to implement solutions here and statewide that will help to reduce and treat drug addiction. Thank you to Melissa Daughter, the Marathon County Health Department, our fantastic local healthcare community, and everyone for working so diligently on this issue. I look forward to continuing to work with you in the future. So it is now my pleasure to welcome Jackie Caratinni, Family Living Agent with the UW Extension, to discuss factors that influence youth substance abuse.
Hi, as she said, my name is Jackie Caratinni. I'm the Family Living Agent with the UW Extension office here in Marathon County, and I'm glad to be here today on behalf of, one, I grew up in Marathon County, so as a lifelong citizen, I want the community to be a safe place for youth to grow up in. Two, as an educator, I know the importance of the values of being able to have the risk factors that we know will influence kids and can help them grow. And three, as a parent of a 9-year-old and a 12-year-old, I also want them to have a safe environment to grow up in. We have decades of research from several resources, but one from the Search Institute and two from SANSA, really being able to identify some really key risk factors. I won't go through all of them, but in the back there is a handout on the 40 developmental assets, and really can very specifically identify things that we know if we can show support, both familial support, community support, school support for kids, they're more likely to succeed. Empowerment, what are values, what are resources that are out there for kids to be able to, again, help them. Boundaries and expectations. Are there very clear and identified boundaries, both in a school setting, in a familial setting, and how closely guarded are those boundaries? And then are there opportunities for constructive use of time? Are there after-school programs? Are there weekend programs? Are there school activities, sports, things that they can get involved and engaged in to keep them active? So that comes from the developmental assets. Then there's also the piece that we know that if we can limit the risk factors and strengthen and increase the availability of the protective resources, this will help to reduce substance abuse and create healthier communities and for our individuals and also the community as a whole. So some of those risk factors we know are, one is early age of onset of drinking. So it has a tendency to be early adolescence, but we know that the younger that they're exposed to it and the younger they start, the more likely they are to have more significant problems later in life. So if we can work on that onset age. Another one that really is an issue is being able to identify those risk behaviors and problems. And the more significant the risk behaviors are, and again, if we can identify those early and work with kids in a positive environment, they're less likely to have, again, turn to drugs and alcohol and have major issues later in life. Perception of drug and alcohol use, both from a family support standpoint and then also from a community standpoint. So I'm going to give an example. We go camping in the summer, and not that nobody in my family drinks, but we're sitting around the campfire and another family came over and they had 14 and 15-year-olds who were having wine coolers. And that is not okay in our family. And my whole family just kind of looked at each other and didn't know if they should get up and leave or if they should just say, that is not okay, and did. And the other parent said, you know what? I'm glad you said something. They said, we've never, not that we agree with it, but we've just never said no. And no one's ever really brought it to our attention. So that's one of those, are you standing for it? Are you standing up for it? And what is the environment? Is it okay to let kids drink? And what is that community involvement? And what is your attitude towards alcohol, both in your household and in the community, and where do you stand on that? So that's big too. Another one is the perception of harm. If kids think that it really isn't that big of a deal, my grandpa had a beer every day, for 20 years and he's fine, there's no issue. It's that low perception of harm. So really zoning in on kids at an early age to say, what are the dangers of alcohol and drug abuse, and where does it lead, and what are those, what does it look like later in life? And the more we can make them aware of that, again, you're reducing those risk factors. Access and availability. Again, we know that where are they getting it from? They're getting it from family and social resources. So if we can limit those access points, again, we can reduce that and try to eliminate from happening. And then another one is a poor school achievement and being able to bond at school and events. So being able to identify, Nancy and I were just talking earlier, being able to identify those kids that might be kind of borderline and not being involved, and how can you reach out to them and help them become engaged? Huge. One of the things that research tells us is that if there was someone other than your parents that can reach out to a youth and bond with them, they are significantly less likely to have a substance abuse later in life. So this is a grandparent, an aunt, an uncle, a neighbor, someone at church. It doesn't make a difference. But someone other than your parents reaching out to a child and showing concern and trying to impact them. So think about that. What can you do? Can you be that person? Can you identify with a young person and try to have an influence on them? That's huge. The other thing is lead by example. Try to be a role model in your community. Again, what is your attitude towards drugs and alcohol? Where does it sit? And are you going to take a stand? Are you going to be that one to say no? And publicly, can you publicly take a stand and let legislators know where our community stands when it comes to, again, drug and alcohol and issues facing young people? Privately, state your feelings when you're talking with friends. Let them know, this came up, this is what we're dealing with. How are you dealing with it? And really open up. Sometimes publicly it's not enough, but sometimes just a one-on-one from your friend or a neighbor or someone, again, at church saying, hey, have you noticed this? Sometimes that's all it takes. Because again, as parents and as a parent myself, sometimes I'm oblivious to things. I don't see things, but someone else can see them and notify or notice some things in my child. So I welcome that. And so if you do, please say that to someone. Take that personal time to just mention it, because that can make a difference. And then lastly, take the time to create community dialogue. And it can be in your office, it can be in something formal like this, or again, do you have a community group or a club where you can have a conversation about do we always have to have alcohol if there's going to be kids around? What are attitudes? What are you telling your kids? And really start that community dialogue and be open about where you stand and the impact it can have on others.
Good morning. My name is Stephen Korzinek, and I work for Peaceful Solutions Counseling. And I am a recovering person. I am 21 years sober from chronic addiction, alcoholism, drug addiction. I think when it comes to addiction, we need to stop the shame that surrounds the issue. We need to realize that it's normalized in our community through our own actions as adults. I work through Peaceful Solutions Counseling. I work with male offenders who are arrested for domestic violence or violent behavior towards others. And a lot of the issues that I see are related to addiction, especially alcohol consumption. I also do facilitate a group for at-risk teenagers at North Central Technical College's alternative school. When I sit down and I talk to these boys, I say, where did it start? Where did your addiction start? Where did you start to make the choices that caused you to come to this situation with having to sit with me? And they will often say it started with the medicine cabinet. We often, when we think about addiction, we think about street drugs. We think about illicit use. We forget that in our society we've normalized prescription drugs and drug use through our own mental health and physical health well-being. Through our own use of those medications, we've normalized it that these medications are there for everybody. When I talked to the boys about where they started, they said, well, geez, I see mom taking pills for her back pain. And I see that it makes her feel better. I want to feel better, so I start to do the same. A lot of these kids are 9, 10, 12 years old. By the time they're 12, 13 years old, they're talking about prescription drugs at their school. They're exchanging pills at the lunch table. It's all normal to them. They don't think anything about it. By the time they're 15 and 16, they're hooked. They're addicted to something, and they're starting to seek out alternatives to those pills that are hard to get for them. So they turn to alcohol, marijuana, and other illicit drugs that permeate much of our community. And then they end up finding themselves in a place that they vowed that they would not become because they've seen it from their parents. And that's what I did. I grew up in what appeared to be a very stable household where my parents were good providers and both professionals. But they had alcohol issues. And in my family, everyone drank at the holidays around the dinner table. It was all condoned and normalized. But I remember at age 11 that I was concerned about my parents' alcohol because I saw how it affected their behavior and the domestic violence and the abuse that happened within our family. But it was all covered up. It was all normalized. So as I grew up, I was confused about what I was experiencing and seeing, and I was very angry. So at 11 years old, my sister was 15 and I was 11, and we pricked our thumbs and we said, we aren't going to become our parents. We're not going to drink alcohol. We're not going to have children. We don't want to repeat the cycle. But it had already set into me. I already did not think enough of myself. I already thought that I was a failure at a young age because my parents said you can never do it good enough. I took everything very personal because my parents saw alcohol as their choice to love rather than their children. And I see that every day in my work. And so by the time I am 15 and 16 years old, I'm feeling so hopeless about myself. I try to seek alternatives to feel good. And what are my parents teaching me? But, go to the bar after church on Sunday and feel good. So I vowed that I would not drink because I was afraid of alcohol. So I started to do drugs. I thought, it's safer. And I remember the first time I smoked marijuana was the first time that I didn't feel afraid or alone or isolated. And I went, oh my God, I'm going to do this the rest of my life. By the age of 18, I was making my own freebase cocaine, even though I did not want to become an addict. I did not want to become an addict. I knew what it was. I saw what it had done to my family, but I felt I couldn't stop. By the age of 23, I was homeless due to my cocaine addiction in Milwaukee. And then I ended up having to move back in with my mother, who was very verbally abusive. And I had anger issues. And I started to become violent, especially because I could access alcohol easier than any other drug. And in my family, alcohol was acceptable. And so I started to drink. And as my drinking increased, my violence increased until I ended up being arrested for my behaviors. But I wasn't ready to learn. And that's what I see with so many people is it has to be on their terms, but we have to understand those terms. It takes a lot of patience and trust to be there with someone who's in addiction and wants to seek recovery. So, I ended up in Wausau. My sister brought me up to Wausau to try to save me. And she couldn't, no one could save me but myself. So I drank until I started to have problems with my liver at age 30. And I admitted myself into the healthcare center. And I remember walking in there the first time feeling hopeless, alone, and isolated, much like I did most of my life. And I didn't feel that anyone believed in me because they thought that I was too far gone. They thought that I had done too much damage to myself. And when they admitted me and I detoxed, I found out many years later that it surprised everyone, and I got into treatment. But my physician that I had at the time and everyone, no one believed I could do it. They gave me 1.5 years to live, and it took me 2 years to gain recovery, and I didn't die. And that's when I said, maybe I need to learn how to live. And I had to change my thinking about what it was to be an addict, what it is to be in recovery, and what it is to heal. It takes a long time. It takes a support system. It takes non-judgment. It takes understanding. It takes tough love. It takes respect, but not letting them get away with anything. We must be held responsible for our actions, but we first have to be willing to admit to our actions in order to heal them. And that was the biggest barrier that I found in myself, and that's what I see in the clients I deal with today. So when I sit down with a man who's been 5 OWIs, numerous arrests, all related to alcohol typically, I say to them, wow, if I can do it, you can do it too. Because I don't think anyone thought I could do it but me. That was the biggest barrier I had within the system, was getting people to believe in me. But there was one man. All it takes is one person to reach that person who's in addiction to pull them out. For me, that man was Don Olson. He was a counselor at the healthcare center, and he was incredible. And the only reason I opened myself up to him is because he didn't judge me, and he listened to me. And he had similar experiences to me. And through his guidance and support, he brought in other people who helped guide and support me. And I had a whole team. And when I go into the healthcare center, I felt welcomed by this team. And as I gained recovery, they started to use my ability to come out of this to help other people. And Don helped me go back to college, even though my physician said I couldn't because my brain was too far gone. I didn't listen to anyone but myself, really. And I said, if I can overcome all of the addiction, all of the abuse, all of the things I've done, I can do anything. That's what we have to motivate someone who's in recovery, that if they can live through what they've done, they can do anything. When I meet with a group of men on Thursday nights at our office, and these are all high-risk male offenders who've been in the system for many years, I say to them, society has labeled us as no good. Criminals, drug addicts, alcoholics, abusers, whatever it is. I said, that is what we've done. That is not who we are. The reason we're doing those things is because we don't know who we are, and we got to figure that out. Underneath all that bad stuff is something good. But have they ever had the opportunity to find that good and bring it to the forefront to change their lives? That's what I do. And I say, everyone in that room who struggles with addiction, who's had all this trouble within the criminal justice system and lawyers and fees and fines, and I said, wow, you guys are incredibly strong because you can sit in this room and face it and talk about it and bring light to it. That's what we need to do with addiction and recovery. We need to bring light to the dark. As a society, these issues have been going on for decades. And it is nothing new, and we still struggle with it today. But it's groups like this that come together to make the positive change in the community that says there is hope. And I think I represent that hope too. And every guy that I work with, every teenager I work with represents that hope that there is change that is possible. But it comes with compassion, understanding, non-judgment, respect, forgiveness, and even love. We all need that. And that is what I find to be the biggest barrier to getting these men to a better place, is being able to love and value themselves even though they've done bad things. And that's what I had to do, and that's what I teach. So whenever anyone comes to me for help, I say, of course I'll help you as long as you're willing to help yourself. But we have to give them the forum to do it, and we have to be able to talk about it. Like Jackie said, in our community, we need to be able to talk about it and not be ashamed of it anymore. It's an issue, nothing to be ashamed of. It's something that's been going on since all of us were little kids. And it needs to be dealt with in a rational and healthy way, to say we need support services, we need good AOD counselors, we need healthy treatment facilities, and then we also need to be realistic about how much it really costs in Marathon County and the state of Wisconsin to deal with the alcohol and drug issues that we have going on. So we have nothing to be ashamed of. We can only go up from here. It's when we can bring the light to the dark and talk about these issues honestly that we can change the future. And that's possible for anyone. So I tell everyone, if I can do it, anyone can do it. Anyone can. And yet, I remember thinking many thought that I could not. Many thought that I could not. And I will tell you, to this day, my family, who we are taught is our biggest support, isn't always the greatest support. When we come from addiction, our families often are very threatened by those who seek recovery within that family. So even though I sought recovery, my family disowned me when I was 25, and they have never taken me back, because to this day, even though I graduated college, I was a youth pastor, I've been working with teens for 15 years, and working with male offenders for 6, I'm still no good, I'm still a criminal, I'm still a thief, I'm still a con artist, and I'm still a drunk. Because they don't want to look at the real issues that caused all of it. And that's where forgiveness comes in. They did the best they could with what they were given, and I did the best with what I was given to make something out of it. So thank you.
Wow. Thank you. Following that, I want to thank everybody again for attending our 4th and final press conference of this year. It's hard to believe to me that it's been a little over 7 months that we started our Pushback initiative. And we started it with 3 goals. They were simple. First, to raise awareness on the scope of the problem, the fact that heroin, prescription medications, and illicit drugs are a threat to our public health and safety. The second is to make sure that we have enough funding for prevention, treatment, and enforcement, because not one arm of that can do it alone. And lastly, and I think it was most important, is to engage the community in this effort. Like Francis said, we've done a lot of outreach to engage the community because we are all impacted by it and we really all play a part in the solution. We have seen many successes and we know we're not in this fight alone. Over the last year, we've seen a lot of state initiatives that have also helped benefit us here in Marathon County. The Department of Justice, under the Attorney General's office, has launched the Fly Effect campaign. It's a public awareness campaign that's targeting teens and young adults, our most susceptible population. They've also given out grants of $25,000 to 5 communities across the state who are showing collaborations to address the issue of heroin. Wausau was one of those that received that grant. We're very lucky for that. The State Council on Alcohol and Other Drug Abuse actually has put out a series of different recommendations for different policies that we can pass both at a small level within businesses, for example, or systems, or at a local, state, or federal level. We have some copies in the back for people that would like to see those. Most recently released was a 911 Good Samaritan recommendations to help reduce heroin overdoses in our state. Lance Leonard, Assistant District Attorney, and I, and Deb Piscotti from Wausau Health Services are actually serving on another committee that's working on addressing that scourge of heroin in our state. There's also a number of different new legislation that have been proposed, not only for issues such as showing a photo ID when you pick up a prescription painkiller, or allowing our first responders, including law enforcement or volunteer firefighters, to be able to administer Narcan, which is a life-saving injection to bring people back from overdose. Those are just a few of the things that have been proposed. And again, we have a copy of all the different legislation that has been proposed through that. And a lot of it comes from Representative Nygren. If you haven't heard, he's a representative of Marinette. He's gone around the state. His family is working through addiction and trying to support their daughter who has had, just with the nature of addiction, has had relapse. And at some times, they didn't know where she was. They didn't know if she was alive. And at a state and federal level, we've also seen an increase in proposals for funding for things like alternatives to incarceration, as well as expanding mental health and substance abuse treatment services. So as we continue our Pushback initiative, we really recognize that local resources to help address addiction and treatment, really, it's great. The need is great. For anyone who has searched for tips on identifying if somebody may be using or where to find help, it's really a daunting task, especially if you're a family in crisis, especially if you're trying to find your spouse or a sibling or someone that you work with the help that they need. In the work that I do, I've heard so many stories from different families across our area, from those that continue to battle addiction, from those that are in recovery, and from those that have lost their loved ones to their addiction. It's heartwarming, it's heart-wrenching. It's really something that has left an impression on me, and I know with the people that I work with, it's left an impression on them as well. And it's not uncommon that the sentence starts with, "the thing I wish I knew," or "I want our experience to help others." In looking at our options, both currently what's available, what has been tried here locally, as well as what's going on in the community, in communities throughout Wisconsin, we knew we had to do something fast. So the goals of our newest initiative that's associated not only with our Pushback Against Drug Abuse initiative, as well as the Alcohol and Other Drug Partnership, is really looking to link those that are concerned about their loved one's alcohol or drug abuse to resources like finding treatment and how to be supportive in recovery. TakeBackYouth.org will serve as a resource, bringing together people, bringing together all that is out there on the web. Like I said, you search for it and you find 30,000 different hits, and really we want to make it easy for people to find what they need when they need it. A connector to connect those that are looking for services with our local treatment providers, connect them with educational opportunities provided through the Alcohol and Other Drug Partnership. TakeBackYouth.org is also going to be a listener. We're going to be putting a blog feature on this site. We're also going to be having frequently asked questions for all those things I wish I knew, or all those questions that are out there, so we can learn from each other on this issue. And an advocate. We are in a treatment crisis, especially when it comes to youth and young adults in our community. We do not have any options. And when you take a youth and you send them hours and hours away for this treatment, you're taking them out of a situation where they lose that support, whether it's their family, whether it's other adults in their lives. They're losing that support. We need to do something. We need to do it now. So this TakeBackYouth.org was put together by talented and passionate people, and we're looking to launch it in January of 2014. We're going to need your help to ensure that the I Wish I Knew, and this is a great resource, is on this site so we meet the needs of those that visit it. We're going to need people to help promote it and link parents, caregivers, and other concerned members of our community who reach out for help. And finally, we're going to need the community to invest in this effort, in the health and well-being of our youth, and help donate to support this valuable resource that is much overdue. We know that with the disease of addiction comes the chance of relapse and the overwhelming feeling of hopelessness, like Steve said, not only for the person addicted, but also for their families, friends, and colleagues who want to help. But there is hope. Prevention works, treatment is effective, and people do indeed recover. So as with this holiday season, I invite you all to commit to do something. Support a loved one. Reach out. Educate yourselves on how to get involved and join us in this fight. Thank you.
Thank you, Jackie, Steve, and Melissa, particularly Melissa, for giving us a peek into the future for all the work that you do to support a drug-free lifestyle and recovery in Marathon County. As we've discussed, there are many things that influence people's decisions related to drugs and alcohol, and there are many things that we can do to curb the effects of drug use and abuse in our neighborhoods. We know that Wisconsin cares about this issue and that there are resources out there to help us. Mother Teresa is often quoted as saying, "Not all of us can do great things, but we can all do small things with great love." I believe that we are here today because we love this county. It is our home, and we do not want those who share this home with us to suffer. Coming today is a small thing. Sharing our website with friends and colleagues is a small thing. Signing up to participate in one of our short-term action teams or donating to the AOD Partnership at aodpartnership.org to support efforts like this is a small thing. Providing support to those struggling with addiction and or recovery during the holiday season is a small thing. If we all do one of these small things together, we can push back against drug abuse and misuse in our community and do a great thing. For more information about what is available in our community and how you can help, visit pushbackdrugs.com. Thank you everyone for joining us today, and we look forward to seeing you in 2014. As Melissa mentioned, there are information resources and sign-up opportunities in the back. Thank you.